You imagined breastfeeding would be magical. But now you're crying with your baby, feeling pain, frustration, and even guilt. Take a breath. If breastfeeding feels harder than you thought, you're not alone. And there are real ways to make it better. Hit that like button, subscribe to the channel, and turn on notifications, because in this video, you'll learn real strategies to improve your breastfeeding journey. Many moms struggle in the beginning, sometimes for days, even latch, milk that seems delayed, a baby who cries but won't nurse, or pain that feels unbearable. But with the right info, support, and a few changes, you really can breastfeed with more ease and confidence. We'll cover the most common struggles and, most importantly, what you can do to fix them. You'll get tips on latch, positioning, breast care, signs that your baby is feeding well, and when to ask for help. Take a deep breath. We're in this together. You've got this. And your baby needs a supported, informed, and loving mom. Breastfeeding is natural, but it doesn't always come naturally. Not for moms and not for babies. Many challenges pop up, especially in the first weeks when everything is new and your body is still adjusting. Poor latch. This is the biggest issue. If your baby doesn't latch properly, they won't get enough milk, and it can hurt your nipples. A good latch means baby's mouth is wide and covers more than just the nipple, including part of the areola. Cracked and painful nipples. A bad latch often causes pain, cuts, or bleeding. It can make moms scared to keep going and lead to early weaning. Sleepy or uninterested baby. Some newborns fall asleep before finishing a feed or seem uninterested in the breast. That can affect milk intake and reduce your supply. Low milk supply. Many moms think they don't have enough milk, but usually it's about how often the baby nurses or if the latch is off. Milk production works best with frequent feeding and good suction. Knowing these challenges is the first step to fixing them and feeling less guilty. You're not alone, and this is more common than you think. Now that you know the common struggles, let's talk solutions. The good news? A few small changes can make a big difference for both you and your baby. Learn the right latch. Your baby's mouth should be wide open, covering as much of the areola as possible, not just the nipple. Their chin should touch your breast, and their lips should be flipped out. If it hurts, stop and try again. A good latch helps avoid pain and makes sure your baby gets enough milk. Try different positions. Some moms and babies do better in certain breastfeeding positions. Sitting up, lying down, the football hold, or the straddle, babysitting facing the breast. Test what works best. Use pillows for support and to avoid back or neck pain. Take care of your breasts. You don't need to wash before every feed. After feeding, you can rub a little breast milk on your nipples to keep them soft. Avoid soaps or strong creams. If you have cracks, lanolin can help. Stay hydrated and eat well. Milk production needs energy and water. Drink plenty of fluids and eat balanced meals. Don't go on strict diets while breastfeeding. Feed on demand. Let your baby nurse whenever they want. It might feel like they're feeding all day, and that's normal early on. The more they suck, the more milk you'll make. Skin to skin helps. Holding your baby against your bare skin boosts milk hormones and helps bonding. Breastfeeding takes practice. Don't be afraid to adjust, ask for help, or pause to breathe. You're learning and doing great. One of the biggest worries for moms is my baby getting enough milk? Since breasts don't have measurement lines, it's a fair question, but there are clear signs to look for. During feeding, watch for steady sucking with little pauses. Your baby's jaw should move near the ear, and you might hear them swallowing. That means good milk flow. Wet and dirty diapers. After day 5, your baby should have about 6 wet diapers a day. Regular poops are also a great sign, especially in the first few weeks. Weight gain. Your pediatrician will track this, but you can notice if clothes are getting tight or if your baby's rolls are filling out. That shows healthy growth. After feeding behavior. If your baby lets go of the breast on their own, looks calm or sleepy, that's perfect. But if they're still fussy, crying, or always looking for more milk, you may need to check latch or supply. Crying isn't the only hunger sign. Keep watching your baby closely for what they're trying to tell you. Even with all your effort and love, sometimes breastfeeding needs expert support. Asking for help doesn't mean you failed. It means you care about yourself and your baby. Ongoing pain while feeding. If you've tried fixing the latch but it still hurts badly, it could be something more, like internal cracks, a yeast infection, or even a tongue tie in your baby. Poor weight gain. If your baby isn't gaining weight or is losing too much in the early weeks, get support. It's not always about milk supply. It might just be a small tweak in technique. Baby upset during feeding. If your baby cries at the breast, refuses to latch, or keeps pulling off, it's worth checking with a lactation consultant or pediatrician. Low or too much milk supply. Both situations can be tricky. A consultant can help you balance things so you avoid pain, engorgement, or frustration. Thinking about supplementing. Sometimes extra formula is needed, but always get advice before starting. Done right, it won't harm your breastfeeding journey. Lactation consultant, support group, or even talking to other moms can help so much. You're not alone, and the right support changes everything. Breastfeeding can be hard, tiring, and painful at first. But it can also become a powerful bonding moment full of love. The most important thing to remember, you're not alone. With support, patience, and the right info, it gets easier. In this video, you learned about the most common struggles, how to improve your latch and milk supply, what signs to look for in your baby, and when to get help. And above all, it's okay to ask, take your time, and keep going your way. Now we want to hear from you. What's been your biggest breastfeeding challenge so far? Share in the comments. Your story could help another mom out there. Don't forget to like, subscribe, and hit the bell icon for more tips like this. This video is educational and not a substitute for medical advice. Always check with your doctor or lactation consultant.